All right, good afternoon. My name is Sarah Badman. I am with HIPAA. This is our second webinar in our Security Over Compliance series. Today we are very fortunate. We have Martin Edwards, the Compliance Officer at NTT Data Services, presenting for us on to assess or not to assess guidance on vendor security. So we are very excited to have Marty and you with us today. Thank you so much for joining us. So a little bit of housekeeping before I introduce Marty. All of you guys are coming in with your microphones muted. Marty wants to encourage a lot of feedback and interaction during the presentation. So at any time, you have two ways to communicating with Marty. One is unmuting yourself and just speaking up. Second, you can utilize the chat function to send questions over, and I will read the questions out to Marty as the opportunities present themselves. Another thing is the webinar today is being recorded. You will all get a copy of the recording at the end of the day today. So without further ado, I'm going to go ahead and introduce Marty. So like I said, Marty is the Healthcare and Life Sciences Compliance Officer at NTT Data Services. He has over 20 years of healthcare operations management and compliance experience. He has provided leadership to hospital-based ambulatory clinics, hospital-based physician practices, and IT service providers. He provides HIPAA, privacy, security, and CMS subject matter expertise and leadership related to the information technology services at NTT Data. He provides an array of services to healthcare providers, health plans, and healthcare exchanges. His specialties include HIPAA, privacy, security, CMS, healthcare compliance, hospital operations, and data security. He is also certified in healthcare compliance and healthcare privacy compliance. So with that, Marty, I'm going to hand everything over to you. Thank you so much.
All right, thank you, Sarah. Good afternoon. I'm assuming everybody is in this afternoon where everybody is, but just in case, good morning as well. Thank you for the opportunity to speak to you all today about vendor security. This is actually a topic that I'm actually surprised we actually have to have this kind of discussion. You know, in today's environment, with the sensitivity that is around protecting information, particularly health information, that we're actually having these kind of conversations, you know, today. But based on some information I'm going to share with you here in just a second, it's quite evident that we still need to improve upon our vendor security processes and how we evaluate vendors to ensure that they're protecting our information, you know, information that may belong to business associates as well as covered entities. So what I want to do first is start out with a slide here, and I pulled this information directly from the HHS Wall of Shame. Hopefully nobody on this call that you'll see your name on here. It's not meant to call anybody out. But if you take a look at the information that you see here, you can see that we've had quite a few, and this is just a small sampling of a very large population of breaches that have been caused by a business associate. As you can see here, most of these breaches were hacking or IT incidents. I actually did a little digging into some of these, particularly the large one with Magellan. These were actually related to phishing attacks or email compromises. So he gave us some indication that maybe some of our business associates or our vendors, their email security program may not be as strong as it needs to be. And because of that, that needs to be part of your evaluation when you're evaluating the vendor, you know, doing your security review. Some additional information that I was actually able to find out, you know, as when I was researching this particular topic, is that the majority, about 40% of healthcare breaches are caused by vendors or business associates. That ought to be a scary fact for most of us, because many of us, if not most of those individuals on this call today, represent companies that are utilizing vendors for various services that they provide, you know, to you and to your customers. So when I looked at that number, I was like 40% of the breaches are caused by vendor. No wonder we need to have a more stringent approach to providing security, due diligence, and vendor assessments. We have to do so. Additionally, most of the breaches are due to some errors that relate to human errors, system vulnerabilities, malware, and lost and stolen devices. From the chart here, you can take a look. There's only one incident that actually has a theft of a device. But I went back and took a look at some additional information on the site, and there are many incidents where the devices, the breach was caused by a theft or a lost laptop. Why do you think it's reported on them? Because it was probably an unencrypted device. So again, that's why you need to make sure that your vendor risk assessment and due diligence addresses data encryption. And we're going to talk about that a little bit later on in the presentation. But just looking at this slide tells me a lot about the security posture of many of our vendors. It's actually lacking in many instances. Magellan RX, over 300,000 individuals were impacted by an incident back in June. See another large one, NCP Healthcare Management Company, 78,000. And this is just a small sampling. So again, I just want to kind of give you all a visual idea of the magnitude of the breaches that are occurring that are caused by vendors. All right. Next topic here I want to kind of bring to your attention is why you should perform a vendor risk assessment. Well, I have a better question. Why would you not perform one? Based upon what you as compliance officials, privacy officials, security officials, based on what you know, it's best practice. By not doing one, you're actually negligent in your responsibilities, both contractually and probably to your organization. So without any doubt, best practice is something we should follow in everything that we do. In addition to best practices, why you should perform these risk assessments, regulatory is required. If you go back to HIPAA, under the vendor management program, it specifically calls out and states that you must conduct a vendor risk assessment on individuals that will be accessing, processing, and storing your protected health information. There are plenty of instances where that's still not occurring. Probably some of the incidents that we noticed in the first slide there probably resulted from the fact that there was no due diligence done and that the vendor had inadequate security controls in place. Also contractually, I can speak from the NTT Data's perspective that we provide an array of services to providers and health plans. And they flow down their obligations to us, from a data security perspective. We're obligated contractually also to flow down those security requirements to our vendors. How do we validate that? We actually have a vendor risk assessment process that I'll speak to you later on about, that we utilize to help evaluate our vendors and make sure that they can comply with and respond to our regulatory requirements and our contractual requirements. It's something that it just amazes me that we have this kind of gap in our vendor assessment processes. Here's another key point of interest that I think most of you all can relate to as of today. Right now, because of the proliferation of technology, we're now processing data from an array of locations. We're accessing it, processing it, it's being stored offshore, and also from remote locations. Example, work from home. Currently, we are all operating, I'll say, well, all of us, but probably the majority of us on this call are operating in some form of BCP mode. We have employees that are working remotely from home, therefore they're accessing data, transmitting data, doing all the things that they normally would do within a facility in a secured environment. Our vendors are also in those same positions. And therefore, we need to make sure that our vendors actually have the appropriate security controls in place that allows them their workforce to work from home. One of the things that we've done with our vendors, we've actually asked our vendors that support many of our healthcare accounts to provide us attestations and other proof that they have appropriate remote work from home and remote location security controls in place. NTT Data, we have also provided that same type of information to all of our customers. As we began to move toward the work from home model due to the COVID situation, we began to get more questions about it, and we took a little bit of a proactive approach. We put together a document as well as supporting information that we provided to most of our customers, that showed exactly what we did with our devices, how they are hardened and secured, how access to the information, how it's achieved in accordance with contractual requirements. So we actually had to build out a lot of our responses based on individual customer accounts. Some of these steps, may not be applicable to you all, but the basic premise behind it is that you need to evaluate your vendors for activities such as working from home. And that's not the only aspect of it. And we'll talk about a little bit more about some of the other things that you should look at and should be included in your risk assessment. I've spoken a little bit right now, just kind of giving you a little bit of an idea about the vendor risk assessment activities and why we need to do them. Give an advantage of where there's a benefit to the risk assessment being performed. And that's when you have a breach investigation. If you have an incident that was caused by a vendor and it ultimately results in an investigation by local, state, or federal regulators or investigators, it's extremely beneficial to have a completed and up-to-date risk assessment that you've done on your vendor. And I'm not referring to the full HIPAA security risk assessment that a covered entity or a business associate is required to do. But you need to have some type of evidence that you have done some litmus test on the vendor's security posture, understand what controls they have in place as they relate to the services that you provide. Having that kind of documentation can bode well for you in an investigation. And I'm speaking from experience, over the course of my past 25 years in the healthcare compliance space, I've actually been able to mitigate some of the penalties and fines, by being able to produce valid risk assessments, whether or not it's, from the covered entity's perspective or from a vendor's perspective. So again, this is just some valuable information that I want to share with you all today, and hopefully become some useful information as we talk a little bit more about some of the other things. I know I've been talking, a little bit here for the last few minutes or so. Are there any questions or anything about what I've said so far? Any comments, any questions that anybody has? All right.
Yeah, so there's no questions so far, Marty.
Okay, no, that's fine. Okay, vendor security assessments. One of the key things you have to have somebody who's responsible for completing these assessments. Who owns your vendor assessment process? Is it your procurement department? I mean, if you're a hospital or a large company that has a procurement department, if you're a small physician practice or a small, small to medium-sized physician practice, you still have to procure equipment, technology, various services. Who performs that? Who owns that process? Is it something that should be owned by InfoSec? Is it something that should be owned by compliance? I think it depends upon your organization and what your organizational structure is and your business model. Clearly from a small practice or small hospital, you may not have all of these different departments, but you should have somebody who's responsible for the coordination and the implementation of a vendor risk assessment program. Clearly, I'll give some examples of some companies that I'm familiar with. They have it's a joint process. Procurement does help make sure we onboard, that vendors are onboarded appropriately. But as part of the onboarding process, you have not just business and financial assessments that you do about a vendor that you're bringing on board, just to make sure they're financially solid. You also need to conduct a security and privacy assessment, particularly if they're going to be accessing, processing, storing, doing something with your protected health information. Somebody has to own that process. If it's something that you're not sure about, you haven't implemented, maybe these are the conversations you need to have with your leadership and figure out who coordinates our vendor risk assessments. Can we provide an assessment, a validation of an assessment, when requested by one of your customers? It's not uncommon for a business associate to have to provide evidence that any vendors that they bring on board that are supporting the account or the business has a valid risk assessment performed. You need to be able to provide that information, on demand. And it's also part of the regulatory requirements because it clearly states that in the HIPAA regulations. It also states it in CMS regulations, MARS-E regulations, so you need to make sure that's a part of your scope of operations. Vendor contracts are another area where you want to make sure that your privacy and security assurances are addressed when it comes to vendor due diligence. One of the things that many companies will do with their vendors, they will automatically flow down any security obligations that they have that may be holistic, or if the vendor is going to be providing specific services to a specific customer or type of customer, you may also need to flow down those vendor security requirements, the customer security requirements to the vendor. Sometimes that's done in the form of a BAA. I've seen BAA agreements that have been expanded far beyond what BAAs used to look like. And I'm sure many of us have seen things added to BAAs that weren't part of the traditional landscape of a business associate agreement. I also have seen situations where you have privacy and security addendums that customers obligate vendors and business associates to flow down to other individuals that are providing services or having access to their systems and information. That's just another way for which you can ensure that your vendors are aware of what their requirements are. And oftentimes vendors don't necessarily understand what their requirements are from a HIPAA perspective. I have actually had vendors who have told me, hey, I'm not subject to HIPAA. And as part of our vendor due diligence, we take a look and find out what services they are providing, what the scope of services are. And we've actually gone back to vendors and said, yes, you are, and here's the reason why. Well, we've gotten responses. Well, we never have before. That just doesn't set well for most of us. So what we end up doing is validating the need and also providing necessary feedback to the vendor as to why they are a business associate and that they are subject to HIPAA. Ultimately, we've had some vendors that we've not able to do business with, or we've delayed the onboarding of those vendors until they were able to attest that they could meet the regulatory requirements under the security rule and other contractual requirements. Additionally, in the space of vendor security assessments, you want to make sure your assessment is based on the scope of services. If you're storing if the vendor is going to be storing and accessing information, you want to make sure that they have appropriate data encryption, cryptography processes and controls in place. If they're going to be accessing information and information is stored in their environment, what kind of controls do they have on access to your information in their environment? Do they have an access provisioning process that talks about provisioning, changes to provisioning, and termination? A lot of these things sound simple, but a lot of times vendors don't have the granularity and aren't able to respond, particularly some of the smaller vendors. Large vendors like Amazon, like NTT, IBM, Accenture, some of these other larger companies, they're very easily able to provide you the type of support and information that you need to validate their security posture. A lot of times you can find it on the internet. For those of you all who may be in business with some of our cloud providers like Microsoft, Google, a lot of their security information about their position and their posture is located on their website. You just have to know where to look for it. In addition, they also will provide you additional information if required. We have had very good success working with Microsoft and some of their other vendors to get them to provide additional information based on services that they may be providing, to us or to some of our customers. Okay. Any other comments so far from anybody? You're all a quiet audience today.
I know, but I have a question, Marty.
Sure.
What is the best way to conduct these vendor assessments? So you said that it should be aligned with the services that you're providing. So what if we are using a cloud partner, right? So say we're using, so I know a lot of hospitals are now moving to the cloud. They're either utilizing like Armor, Cloudticity, AWS, Azure to actually host a lot of their data. So how do we actually go about doing a vendor assessment with these large companies, or do we just trust them because they're large?
Trust but verify, absolutely. We do trust them. And actually, we're going to speak to that here in a little bit in one of the slides that I've got here next, but I'll go ahead and answer your question. When it comes to those large vendors like, cloud service providers, Amazon, Google, Cloudticity, we're not going to go in and provide and conduct a risk assessment on them to the extent that we would on maybe on a smaller one. What they are very good about doing is they have been good about providing to their customers evidence such as high trust certifications, ISO 27001, 2017 certifications, SOC 2, Type 2 third-party assessments. They've been able to provide detailed third-party assessments that, for the most part, gives me comfort that those vendors or those cloud providers have solid security programs in place. And that's one of the topics we're going to talk about here in just a second, as what do you need to view and what should be part of your risk assessment? How do you evaluate, a customer's position based on certain activities that you need to perform? But clearly, Sarah, what you're indicating, what I would recommend, if we have a company that provides a high trust certification and the services they will be providing fall within that high trust environment, that gives me the comfort that I need, because they are meeting all of the security requirements that are necessary, control requirements necessary in order to achieve that certification. So I'm probably not going to go much further than that, unless there's something specific that I have a concern about, or a certain aspect of the delivery of services that I want to go out and take a look at.
Sarah Parthiv here.
Hey, welcome, Parthiv.
Hey, how are you? So I agree with Marty, because we as a provider of EHR software, we have SOC 2, we can give you enough information that should meet your requirements from an assessment standpoint. I think the bigger issues with the smaller vendors, and especially those who don't deal in the healthcare space, to get them to provide that information will be difficult. But at the same time, then from a service level agreement, what I would recommend, a contractual agreement, is that they should do an assessment, give us the assessment, or they let us do it, right? One of the two ways.
Mm-hmm.
But some proof has to be there that that's been done, because with Marty's first slide, where I show the business associate, the breaches that happen, and that's reality out there. So I think some shape, size, or form, either contractually they're obligated to give you a risk assessment report, a high trust, or whatever, however you want to put it into the contract, or they let you go and do it yourself. I mean, that, I don't know what Marty's thoughts are, but you need something concrete in there. So.
No, I agree. I agree. There has to be an assessment that's conducted. Either the vendor provides you with enough information that satisfies your concerns about their security posture and answers specific questions. If not, you have to conduct one on your own. At least you should conduct one on your own. I think that's where a lot of the gaps are today, is that not all vendors get assessed in the particularly in the healthcare space. And that's why I'm trying to limit our conversation to the healthcare space. Mm-hmm. But I would agree with you. We have to do it one way or the other. You can't just ignore it and just assume, hey, they're a good vendor. I know them by name. They're a small company. They've been working for a friend of mine's company. That's not a risk you want to take, because it only takes one incident to create a large enough problem that you would have benefited far more if you had conducted the risk assessment up front.
Right.
Okay. Any other questions so far? I mean, I'll move on as needed, but any other questions? Well, I got a couple of topics here. I'm sure I'm going to raise some questions here in a little bit.
I'm sure we will.
Okay. Next slide you're taking a look at right now. I just said, are all vendors business associates? For the most part, in the healthcare space, yes, but there are some exceptions. I'll take a look at IT services companies, like IBM, NTT Data. Those companies provide an array of services, from hosting to managed security services, to business office processing, to application management, development. All of those services potentially are going to involve the use and access of protected health information. Clearly, they're a business associate. Claims processing companies. Here's one right here, medical collection agency. Sarah, I believe last week, was it earlier this week or one day last week, you posted on LinkedIn about a scenario where a medical collection agency used information, and as part of their collection processes, they use that in court proceedings, and therefore making some of that information accessible to the public because of the nature of the collection process. Is that correct? Did I get that correct?
Yes, that is exactly what happened. So a hospital uses a collection agency, as most hospitals do, right, to collect on bad debt. And the collection agency was extremely aggressive in their practices. And when they filed the court cases for those patients that were still not paying their bills, they included all of the data, including diagnoses, ICD-10 codes, CPT codes, dates of service, all of the patient information that the collection agency had. So name, date of birth, address, social security number, all of that was provided. and it was made available publicly through the court documents that anybody could log online and Google it, like, and search the patient and see all that data. And so it was a huge breach, and it was the collection agency that caused it, but the vendor is, or the hospital rather, is still working through this breach. It'll be interesting to see what happens, but they may be held liable for that breach that the vendor caused.
And in response to this particular scenario, I've thought about this, and I don't think my answer is the end all be all. But first part of it was the collection agency's processes within regulatory allowances. Is it part, in my opinion, initially it was part of TPO, treatment, payment, and operations. Collections is part of the payment process. Information can be used for that purposes. So, but by providing that information to a public entity such as the court system, and that information being potentially accessible outside that, is that considered a breach or just an unauthorized access? I think you have, at this point, I don't have a definitive answer because I haven't had a chance to really look at all the details. I don't have all the details around it. But from a vendor due diligence perspective, this gives you an example of whoever the hospital was, I don't know if they did, but let's assume they didn't. They should have had a conversation with the collection agency to understand exactly what their collection processes are as they move along the continuum. And when it comes to the point that they actually have to go to court, or seek out, legal remedies, in the court systems, what should there have been some type of notification back to the hospital so that they're aware of what's taking place and make sure that there aren't any disclosures of information, issues that need to be addressed? Was this already addressed as part of the contracting with the collection agency and it got missed? I mean, I honestly don't know at this point, but I think this is an excellent type of scenario of where vendor due diligence and taking a look at the actual services that are being provided, that you need to take a look at those and then make judicious decisions about how to proceed.
Hey, Marty, yeah, if you delve deeper into that, let me know, because from my perspective, with information, I thought it was a breach, again, with whatever information SATA did provide. So, but I would love to see what you come up with.
Technically, my first thoughts are, I think it is a breach. The use of the information up until the point that the information was then accessible and allowable, to the public through the court systems. Mm-hmm. I would agree it is a breach. Is there any way to limit that? Maybe, is there an exception? Maybe there's some exception, in the regs in the very bowels of the regs that I'm just not familiar with.
So switch the topic. I don't know, Sarah, how much time we have, but we can shelve this. NFL, 11 players, 11 teams tested positive for COVID-19. That data was released, right? You know who it is. Now the question is, did the players sign it, agreeing that, because of safety, it's whatever the conditions of this could be an interesting case study too.
Actually, that was a question I had, and I actually have a couple of friends who are in the NFL, and I actually asked them, and they said that they were informed during the testing that certain information would be released, because this is a there's communicable disease that potentially has a wider impact on individuals, and might need to release this information to help protect other individuals and to prevent the further spread. So they are aware of it. Now, under what circumstances their names would be released, they said that had to be approved. There have been certain situations here recently that I'm aware of where names were disclosed and the player did not authorize it to be done that way.
Right, and again, the question becomes: did the players' associations agree that they would, or they signed up on that? You could release your name, right, because of safety, et cetera, as a contact sport. Yeah. But that's the issue. If they didn't sign, then it would be a breach, right?
Exactly, and because of the contact tracing that they will be done, that is typically can be done, those would be issues where the players would have had to, allow their names to be used because they may need to contact other individuals. Mm-hmm. But these are the kind of scenarios that are being presented, every day across the U.S. in different environments, not just in the healthcare environment, but in, any place where you have personal information being exchanged for legitimate reasons. All right. I appreciate the comments and the questions for sure. A couple other points in here I want to make, about cloud service providers. I think we've already talked about it earlier. That was one of the questions that I think Sarah had asked about. How do you respond to vendor assessments when you have a cloud service provider such as Amazon and Google? Again, those are going to be entities that you're not going to have difficulty getting evidence about their security program. It's not going to be a problem. At least it has not been for anybody that I'm aware of. Here's one from a SaaS provider. Software as a service. Depends upon where the application is being hosted. If the SaaS agreement that you have is SaaS services that you're acquiring is going to require the information to sit in your environment, then all the security controls are on you, the covered entity, the business associate. If the SaaS services are sitting in the SaaS provider's environment, yes, you do want to make sure that you conduct a risk assessment. Make sure that they're securing that information. You will want to make sure that they execute a BAA agreement. I have had some SaaS providers that didn't feel that they needed to. Even though they held the information in their environment, they say, oh, but we don't have access to it. Well, the information sits on your databases in your environment. You have access to it. It's uncommon for somebody nowadays to walk out of a secured facility with a blade in their hand, but it could. It has happened. I have seen CPUs walk out of facilities inside the purse of inside somebody's purse. Well, it was a lady at that point, not even a carry person that I knew of. So, so that's an example of why you need to take a look at all your vendors and determine whether or not they are a business associate. There's a couple on here that clearly are not. Janitorial services and courier services. Those are not business associates. They're not covered entities. But we do have some security obligations that I just like to mention to everyone and make sure that your employees and your staff are securing information in a manner that's in accordance with your company's security policies and within the HIPAA security rule and any other regulatory rules that you may have to adhere to. CMS has an array of security protocols and guidance that you may have to adhere to. Courier services typically are not, FedEx or US Postal Services. They're typically not involved with as a business associate. But they do provide some services sometimes that you want to make sure that your certain information that you may send via FedEx or UPS that may contain PI or PHI, you do want to be able to track its receipt and delivery. So, and those are just some additional comments and steps. I don't think they necessarily fall into the vendor business associate due diligence realm, but I just thought I'd mention that to you all. Okay. Here's a topic here that I think will be of interest to a lot of you all, and hopefully so. Business associate agreement. Is that the execution of a business associate agreement? Is that sufficient all by itself in order to satisfy vendor due diligence? In my opinion, absolutely not. There could be a vendor out there who signs the agreement because he really wants the business, and it does happen. You've accepted a risk at that point if you have no idea about the vendor's security posture. So again, you need to conduct that risk assessment in order to determine what kind of risk exists or doesn't. But just simply accepting a BAA agreement is just not sufficient. And I would strongly recommend that anybody that's doing so to rethink that and have the appropriate conversations with your business leaders, your legal team, whoever's necessary. Also include your compliance team because they will guide you, compliance and security, they will also guide you efficiently as well. Performing a vendor risk assessment. First of all, there is no single right way to do it. There are many different ways in which a vendor risk assessment can be performed. You can design and implement one on your own, utilizing maybe a software and application that may be commercially available. You can develop your own. Within my company, NTT, we actually started out years ago with Excel spreadsheets collecting information. We've subsequently taken that information and created a module within our GRC tool called Algorithms. And we've developed a very robust litmus test of security questions that we will send out to vendors. They respond back to us. And then we're able to evaluate their responses and determine whether or not there's any risk or follow-up actions that need to be taken, before they get approved to move on. I've noticed out in the, on the internet, there are a wealth of vendor assessment software and even companies that actually perform it. Sometimes in hospitals and health plans that I've been involved with, they've actually taken and developed their own questionnaire and sent it out, via an Excel spreadsheet, asked us to complete it. I hate those 200 and 300 SIG requests for security input. It takes forever, and it could be satisfied if I could send them a copy of my high trust certification. But a lot of vendors, customers won't simply accept high trust alone. Hopefully we'll get to that point at some point. That standard assessment, third-party assessments such as high trust, SOC 2 Type 2, and ISO certifications will satisfy, customer requests for, and evidence of security. But we got a long way to go, but we're trying our best to get there. But these are some of the steps that I could recommend on how you conduct your vendor risk assessment. Next step is like, what do you look for when you're conducting that assessment? What are some of the things that you need to pay attention to? And there are many. The next slide here that I have for you actually has a sampling of things to take a look at. And then later on, the very last slide, I'm going to show you something that hopefully you all will be able to take away and use it if you need to or would like to. You want to take a look, does the vendor have a designated privacy and security official? Somebody needs to be acting in that role. No matter the size of the organization, somebody needs to be acting in that role, whether or not it's an office manager to an actual CISO or a privacy and security official or compliance officer. Confirm that the vendor has a security program. Request evidence of it. Have them send you a copy or visually evidence their security program. This can be done by WebEx, Zoom sessions. That's what we, at NTT, that's what we do multiple times throughout the week, is provide visual evidence of our security programs, as well as our information security policies. I recommend not necessarily giving them hard copies, because if you're doing your due diligence on your policies, procedures, and your program, it's constantly being updated and changed. So you always want to make sure that your customers, your other subcontractors have up-to-date policies and procedures. And I may give you one today. 6 months from now, I've edited. I've made some modifications due to some industry changes and recommendations. Customers then don't have the most up-to-date one. So we like to be able to say we can visually evidence policies and procedures to you anytime you need it. You also want to include, as part of your vendor due diligence, the security training, HIPAA training. Make sure they provide some type of training to their employees. Yeah, they provide it annually or and at hire. And sometimes you can ask them to provide you a copy of it. A lot of the companies are now utilizing online services, so it's sometimes hard for them to give you a hard copy. But again, they can visually evidence that training module for you. You need some way to validate that. Cyber liability insurance. It's another thing that you want to have as part of your due diligence. Make sure the company has the ability to respond financially and from an insurance perspective, be able to respond to a breach. You'd hate to be doing business with a vendor who doesn't have the financial means and didn't have the insurance to cover a breach, particularly one that would, could be 500 or more, cost you a couple of $100,000 or more in fines and penalties. So you want to make sure that's addressed, not only as part of your risk assessment, but you also want to make sure that it's done as part of your contracting as well. Other things to take a look at is vulnerability management. Want to make sure that all their systems are updated, they're managed appropriately, they're patched in accordance with company policy and industry standards. Data at rest and data in motion. You want to make sure if your vendors are storing data, processing, transmitted, that it's encrypted and it's secured. If they can't encrypt your data at rest, why not? And for what reason? What other controls do they have in place, mitigating or compensating controls they have in place to prevent a breach if they don't encrypt it? BCP plan. You want to make sure that the vendor is able to continue to provide you services in the event of a man-made or a natural disaster. I mean, that's most of us are operating today in our BCP modes. And then importantly, you want to make sure they have an incident response plan, a breach reporting process. Typically that's covered in their policies and procedures. Have them evidence that. Reference this kind of information in your business associate agreement, as to what the requirements are. These are just a few elements that should be included in the risk assessment. I've got a document here I'm going to open up here in a second that's going to give you a broader view of information that you can collect.
Marty?
Yes.
I got a few comments here.
Mm-hmm.
One is, first of all, for policies and procedures, and please correct me if I'm wrong, from my world, the HIPAA world, policies don't tend to change, procedures do. Procedures are yours. So my recommendation always is split the policies and procedures so that they're always separate. Your policies won't change, very rarely will they change. Procedures will constantly change, right? So you don't have to go back to the board for approval when a change happens. That's one comment I have. The second one is even more important one is incident response plan and breach reporting. A lot of the times when I review these contracts, they don't have language in there in the sense, if an incident happens, what are they willing to, what role will they play? And specifically, how quickly will they respond to you, right? Same thing with breaches. Is what role will they play in a breach reporting is the provider's job, not their job, for example, right? Because you got to go and report to the agency. So some of these things need some more details in there, and be sure that you have that in your contract as to what the involvement would be, and it's a response plan, right? And from a breach reporting perspective also, what's the procedure they're going to follow when a breach happens?
Absolutely, I totally agree. And getting back to your first comment about policies and procedures being separate, because some of them don't require, policy may not, but your procedure may need to be updated. That's absolutely what I meant. I was addressing this collectively, but clearly policies and procedures are two separate documents. Therefore, the updating of one does not necessarily mean the updating of the other one. But it is something that as part of your internal operations and part of your vendor assessment, you need to take that into consideration when you are conducting those reviews. I absolutely agree. The other one about the breach response and how a vendor will respond or what their obligations are, clearly that's stuff that you should address in your contract as well. The vendor may have an incident response plan that may be very broad because they have a wide array of customers that they may service. But within your contracts with that vendor, you want to specify what the specific obligations, roles, responsibilities that they will have, not just in incident response, but also in the breach reporting process. So you're absolutely correct in those comments.
Thanks.
Anybody else have any comments, questions? All right, I got a freebie here for you all. In case there's anybody on the call who needs a little bit more guidance and some information, hopefully this is gonna work. Uh-oh, it didn't. It didn't work. Well, here's what I'm gonna do. It didn't open up, it did in the test environment, but apparently it's not opening up in this Zoom session right now. The last slide here is actually and hold on a second. Sir, is it okay if I share something outside of the,
Absolutely, absolutely.
Okay. You all just bear with me a second. I did not know that this was not going to work, but I'm gonna pull up a file that I have that actually has the document that I was going to share with you. And so they're going to be able to get a hard copy of the anybody who wants to get a hard copy of this presentation, correct?
That is correct, because you did
Okay.
send it out. They will receive a link to the recording of the call as well as the presentation.
Okay. And then when they open up that presentation, it should open up for them. So let me stop sharing and then reshare the document that I have. Okay, can you all now see my page? Okay.
Yes, sir.
This is and this has been years ago when we were part of a when NTT was purchased from Dell Services, we had to have some transition activities in place. So, and one of them was the vendor due diligence, because we knew we were going to have to move to new systems. We created a Excel spreadsheet that we used to use to send out to vendors to collect information about the vendor's security posture. So what I want to do is just kind of share this with you all. I'm not going to go through it in detail. I'm just going to scroll through it and let you see some of the areas that you can potentially include in your vendor due diligence or security assessment, types of questions that can be asked. And we gather information about the general services that are being provided. You know, clearly you want to know what are the services and from what locations the services are being provided from. If you have a vendor that's providing services from offshore, such as India, make sure you don't have any contractual or regulatory obligations within your own company or with any customers that you may have that prohibits that or it requires authorization. Those are questions you just want to take a look at. Some of the other questions that we ask, we kind of ask more about, you know, what regulations that are applicable to their services, whether or not they perform PCI-related services, if they comply with GDPR, and we ask some other general information. Then we started asking about just some general risk assessments. This is when we used to have the vendor attest to which of these they actually had in place. And if we recognize that they didn't have appropriate certifications in place to support the services they'd be providing for us, we would go back and have additional conversations with them. Could be that they missed something, didn't check it, you know, or they're in the process of being high trust certified. They're not quite there yet, you know, but they will be in several months. But this was a kind of a guidance that allowed us to work through our vendor process. Then we moved on down to capture information about, you know, what data would they be using, processing, storing, creating. You need to know that as part of your inventory, you know, in conducting these risk assessments. Then there's just a wealth of other information in here. I'm not going to go through it all, but these are the different types of documentations, policies, procedures that we would want evidence to. You know, you want them to check yes to every one of these, and then provide you with an embedded copy or a link to it or some response about the existence of these controls. And then we have other questions we ask about user access. We talk about patch management, vulnerability management, remote access, mobile access, general questions we felt were important to us. We talk about malware, you know, content control, you know, how we monitor systems, you know, IDS, IPS, we want to make sure those things are in place. Do we have did the customer or the vendor have any data loss prevention solutions? We talk about encryption. And then specific question related to their vendor management program, because sometimes our own vendors actually had vendors that they brought on board to help support their services. So we want to know about those as well. And we also took a look at physical security. We took a look at BCP plans, you know, disaster recovery, as I've mentioned to you already. Questions related to that. Media disposal, that's a critical piece of it. I believe that was a question, I think, Sarah, that you may have that you want to pose later on as soon as I finish up here about a media disposal issue that was brought to your attention.
Yes, sir. I'll bring it up in just a second.
Okay. And then you've got things about media destruction, incident management. This is just a sample of the types of questions that you potentially should include in your risk. There are others that you're going to identify. There are others that we've even included in ours that aren't included here. But this is a good starting point if you have to create something internally and you don't have a commercial application to use. So with that, that's actually the end of my formal presentation. I want to thank everybody for giving me the opportunity, and I hope you all found this information to be useful. Sarah, I'll turn it over to you for any questions or comments or anything that the audience has.
Yeah, so it looks like, Joni, you raised your hand. Do you have a question? You can unmute yourself and ask the question if you would like.
I do. Are we going to get a copy? Hi, Sarah. Hi. Great presentation today. Are we going to get a copy of this, or is this proprietary information? Because I'm just sitting here with my list and my notes going, I need this, I need this, I need this. Very, very good data to get from your business associates.
Yes, you're going to get, I think Sarah's already made it aware, you're going to get a copy of the presentation.
Yes.
And the slide, the very last slide, when you click on it, it should open up for you because it's a generic, it's non-proprietary, it's nothing proprietary about it. It's generic. Okay. I've removed all of that proprietary information from it. You'll feel free to use it any way you'd like to. The individual on my team who created it or was the principal creator of it. He just said, Martin, make sure I get credit for it. And his name is George. He did.
Aw.
Thank you, George. Okay,
thank
just
you
wanted to be
so
sure I get that.
And
And what I'll do is, because I know it was working for me, is I will save it as a separate file, so
Okay.
that just in case it doesn't work for them, like I've got it saved.
Thank you.
You're so welcome, Joni. So does anybody else have any questions? Okay, perfect. So I'm actually going to read through a scenario that a hospital posed to me. They were going to be on the call today, but then this incident occurred, and so they're not able to be here. But hopefully we can all learn from this. So I'm going to read the situation that the hospital summarized for me, and then we'll talk about it. So the situation, the hospital recently upgraded its security system to a cloud-based, so its video security system, to a cloud-based storage and retrieval system, upgrading from its old tape-based recordings. The hospital waited 8 weeks after the conversion to the cloud-based to destroy all of its tapes, because it's that was what its policy said. They retained all of the tapes for 8 weeks prior to destroying the tapes. The hospital decided to use a vendor to destroy all of those security videotapes. They entered into a business associate agreement with the vendor, and the vendor came on site to destroy all the tapes. The vendor provided them with a certificate of destruction for the tapes that were destroyed on site that day. 4 months after the destruction of the tapes, the hospital was conducting a review of all of its destroyed data and media, and they discovered there was a box of 12 security tapes that was not accounted for on that certificate of destruction that they had gotten 4 months prior. The hospital contacted the vendor to investigate where the tapes could be. The vendor investigated the situation and discovered a box of tapes in the truck that was used to destroy the tapes. The vendor then destroyed the tapes and sent a new certificate of destruction. The hospital is concerned that the tapes sat in the truck for 4 months and could have been accessed. They acknowledge that it is unlikely, as the tapes would require a device capable of playing the tapes in order for the tapes to have been viewed, that they wanted to know if it was a breach. And then they also wanted to know what they could do what they could have done to actually ensure that they were utilizing a vendor that wouldn't leave a box of 12 security tapes undestroyed on a truck. So Marty, what's your advice here?
Well, it's a little bit of a challenging situation for the hospital, first of all, because they first received a certificates of destruction that all of their information had been destroyed. It appears, based on hearing you correctly, it wasn't until the vendor itself identified that these records, that these tapes had not been destroyed or on a truck. Is that correct?
No, the vendor had given them a certificate of destruction, and they had the certificate of destruction that was given to them the day that the data was destroyed was accurate.
Mm-hmm.
But the hospital waited 4 months to review all of its own records. So they were comparing what data they had given to be destroyed and what their certificate of destruction said had been destroyed. And there was a discrepancy of 12 tapes.
Right.
And so then they contacted the vendor to say, hey, where are these 12 tapes that we gave to you that are not listed on the certificate of destruction?
Based on that, there are a couple of things. Even from the standpoint of the hospital, first of all, they should have reviewed their certificates of destruction based on the information, based on the data that they sent to be destroyed. They should have reviewed that sooner than once every 4 months. That was totally inappropriate. And that would be something I would strongly have recommended to them, to change their processes. If that was this an oversight, or was this a standard process to review it every 4 months? Situations like this, we'll give you examples of why not to have long periods of review, particularly when you're trying to validate the destruction of some data, particularly sensitive data. The other question I have is that you said these were security tapes. So these security tapes likely did not contain any PHI, correct?
Well, see, that's where some people get a little bit sticky, right? Where they'll classify, when they're classifying their data, they'll classify security tapes as PHI because they show full face photographs or video of patients as they're in the facility itself.
Okay.
I don't necessarily believe that they should be classified as PHI. I think it's separate from a medical record. It is physical security of your hospital.
Right.
But this particular hospital does classify their security tapes as PHI. So
Okay.
within their own policies, they're kind of
Okay.
shooting themselves in the foot a little bit on what those security tapes should be
Yeah.
classified as.
Yeah, but I guess I'll get back. I think the primary issue here resides with, in my opinion, resides with the hospital, is the fact that they sent information off to be destroyed. They got certificates of destruction back for all but these 4 tapes. There should have been some reconciliation that should have taken place much sooner, so that they could have easily and earlier identified that they had some 4, whatever the certain number of tapes, 4 tapes that had not been destroyed. At least there was no evidence that that was the case. Then they would have gone back. I truly put the majority of the liability on the hospital, but also as part of that, they should have discussions with the vendor to ensure that everything is destroyed, you know, that comes in on their trucks, that they tie back to the destructions that they took with them. So if they left the building with 20 tapes, but they only destroyed 16 of them, that means there's a 4 gap difference. That's a process that the vendor should also have on their end. So it appears to me, from what I'm hearing, there's opportunities for both instances to improve on their processes and
Right.
how they validate, you know, the actual destruction of the information.
No, I would agree with you there. So here's I think one of the questions that this particular hospital did not ask, but I know quite a few of the folks on this on the call today are rural hospitals. They are either critical access hospitals or acute hospitals in rural settings. So the hospital that had this situation today is a 80-bed acute hospital in a rural setting. And rural hospitals are historically, like they're challenged by budget, time restraints, and so forth. So how can we guide rural hospitals to improve processes with, like, in vendor management when they're kind of strapped for time and resources?
Yeah.
So their compliance team, so they don't have an official compliance officer, right? So the privacy sits in the HIM department, the security sits with their IT director, and then they have a committee of 5 people that review information every 3 to 4 months. So what kind of resources should rural hospitals try to get within their own budgets and resources to be able to manage vendors accurately? Is there a process for smaller hospitals to be able to do this to protect themselves?
I wish I had an answer that would be, you know, the panacea for them all, but clearly they have challenges simply because of, you know, resource restrictions that they have. One of the things that, you know, instances like this, it should cause their leadership and their management. And this is where whoever's responsible for this has to have conversations with their leadership about these are critical processes, critical functions. We don't have the resources human-wise to be able to conduct the necessary due diligence internally to make sure that we aren't creating security concerns. We don't have any risk associated with it. Sometimes those are hard conversations to have, but sometimes they're necessary conversations. You know, and then they have the challenge of their budgets. Clearly, how do they allocate, if they're financially aren't in a position to have dedicated personnel, everybody's doing 2 and 3 jobs, then you have to kind of take a look at, okay, who may have the bandwidth, you know, everybody else has got 3 tasks. This person only has 2. Can you add something else to this person? It's not optimal, but you have to kind of take a look at things and see what's available to you within your organization. What kind of availability of time do you have? Is there a way to automate? Take a look at automation. Is there a way that you can automate certain practices so it's not dependent upon human interaction? You know, in this situation, I can't necessarily think of one per se that would have addressed it. But overall, we have to take advantage today of automation and technology to perform as many compliance and security tasks as possible, because none of us, even NTT and IBM, I can't go and hire all the people that I actually need, but I've had to be creative and come up with automated processes or electronic systems that allow me to help, you know, carry out my compliance and privacy tasks.
But Marty, the problem with that also is that to Sarah's point, and I deal with a lot of rural hospitals too, they don't have a budget. They can't do a SIM. No way. They can't put identity access management system. It's too expensive. They
Yeah.
won't even have the resources to manage those, right? Because it's the resource heavy, some of these things. So the question then becomes is how can they, and I don't have a good answer either. One of the things I said
Right.
earlier is can there be a consortium? I'm not saying they become a CE. They're not common entities, right? Separate entities. But can you form a rural consortium which can take advantage the buying power, where 5 of them can buy a service or go through training together? What I'm saying is somewhere where they can find a way to economize, but get reasonable service from vendors or consulting firms or what have you, where they can get sufficient knowledge and how to execute. Then the question becomes is how do you spread the resources, because you're resource strapped. So some places you'll have to take the risk and decide, your board should decide which ones they can let go, which ones they should not let go from that perspective in terms of your tasks at hand. And that's the way you can do it. I don't have a really good answer for it, but just
I don't have a real, I don't think any of us have a real good answer.
Yeah, that was a really good idea though, Pardon.
It is.
And I almost wonder if I can call on one of, I mean, I don't want to call everybody out by name, but I know that there is at least 7 or 8 of y'all on this call that I know are clients of ours and are in rural health. Is there such thing as a rural consortium out there to do what Pardiv just suggested? Is if so, that would be a great idea to kind of help pull everything together to help not just that hospital that had this particular issue, but everybody. Okay, so we have a couple questions here that just came in. So from George, it's a comment, says, having a chain of custody form to track transportation of assets data would have been an additional tool that the vendor could have used to validate that the destruction was done up to the same number of tapes that was picked up. That's absolutely correct,
Absolutely
George.
correct. That's exactly what I was referring to, is that the vendor,
Yep.
that the vendor should have had processes in place to validate what they picked up, they actually destroyed. Absolutely.
Right. And then Joni said, I would recommend doing a review or exit interview with the vendor who destroyed the tapes prior to them leaving the premises to ensure all tapes were captured. Many hospitals, and then she said, many hospital associations and state agencies have rural associations that can assist with value-added resale programs. Oh, that's good to know, Joni. So if you are a rural health hospital that is not involved with your hospital's association, state agency, or rural association, contact them now. I know we work with several of them. I know Joni is a great resource as well. So if you need help getting in contact with the one in your state, please let me know, and I will do everything I can to put you in touch with the right person, because I think that part of it is absolutely correct. Trying to do this on your own, and when you have huge tasks like everything Marty just talked about today, can be quite overwhelming for rural health and as well as small hospitals. I mean, urban health has some of the same issues as well when you're talking about the community hospitals. So take advantage of every possible resource you can, and then contact Marty. I know he would be more than happy to help you guys. We are more than happy to help. Just let us know what we can do to kind of help facilitate. In the meantime, I think that Pardiv should create a rural consortium.
No, I mean, absolutely. I mean, anybody that's attending the call today, if there are questions, comments, or anything that, you know, that you have, want to talk to me, feel free to do so. I have no problem with it whatsoever.
Great, perfect. So we are a little bit over time. Oh, Pardiv, did you have one last comment?
Yeah, I know. If anybody needs to contact me, then they can reach out. I'm on LinkedIn too. So if for some reason any questions, I'll be more than glad to answer them too.
Oh, that's so sweet of everybody.
Yeah.
All right, great. So thank you so much, Marty. I was so excited for today's webinar. You did not let down. This was incredibly informative and very exciting. Thank you so much. If anybody has any questions, feel free to reach out to Marty for more information. Our next webinar is next week. We'll be sending out the registration information along with the information from Marty's webinar a little bit later this afternoon. So thanks again. Y'all have a lovely rest of your day.
Thank you. Thank you, Marty.
Thank you.
Thanks, sir.